अब आप बोलो शुरू करें।
Good morning, students. Now, today we'll be studying about the hypoxia. Today's topic is hypoxia and oxygen therapy. So, it is one of the important topic of the respiratory system which we'll be covering today. So, let's begin, students. So, hypoxia is defined as deficiency of oxygen at the tissue level. So, this is important that deficiency of oxygen is at tissue level. Okay? As the tissue is suffering from the oxygen, when the supply of adequate oxygen is decreased and they fail to utilize the available oxygen. So I repeat, please note down the definition. Hypoxia is defined as deficiency of oxygen at tissue level. So underline tissue level. Tissue level is important. Aap look you miss it. You don't say tissue level. So don't do that. Okay. Now types of hypoxia. Please note the types of hypoxia. Hypoxia is classified into four types. Hypoxic hypoxia. 1. Anemic hypoxia. Stagnant hypoxia. And histotoxic hypoxia. So how many types of hypoxias we'll be studying today? Yes. 4 types. It is classified. Hypoxia is classically divided into 4 categories. Hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. Now, what is hypoxic hypoxia? What is hypoxic hypoxia? Yes, as the name is suggesting, hypoxic means lack of oxygen. Very good. So what is the definition? When partial pressure of oxygen of the arterial blood, remember it, arterial blood, when partial pressure of arterial blood is reduced, the hypoxia is called hypoxic hypoxia. So very important, you have to note that PO2 of arterial blood is reduced, then we will label it as a hypoxic hypoxia. Now, what is the mechanism of hypoxia? What happens in hypoxic hypoxia is that PO2 of the arterial blood is decreased, due to which the delivery of oxygen to the tissues is reduced. So what is the cause of hypoxia? In the case of hypoxic hypoxia is that PO2 of the arterial blood is decreased. PO2 of the arterial blood is decreased, hence the tissue will not get the oxygen or will get the reduced oxygen. This will lead to hypoxic hypoxia. This occurs either due to decreased oxygen in the inspired air. Now, what are the causes? You should know the causes of hypoxic hypoxia also. either due to decreased oxygen in the inspired air or due to diseases of the respiratory apparatus that decreases the oxygen supply to the tissues. So causes, please note, due to decreased oxygen in the inspired air, due to decreased oxygen in the inspired air, or due to diseases of the respiratory apparatus, or diseases of the respiratory apparatus, that both will lead to the decreased supply at the tissue level. Now these conditions when it can be seen, it is seen in the following conditions, like low PO2 in the inspired air. One, low PO2 in the inspired air. Now when this will happen, when we'll get the low PO2 in our, when we are inspiring the air, so we are getting low PO2. Yes, at high altitude, or in the closed chambers, So whenever one ascends rapidly to around 3,000 meters, or to the 10,000 feet around, then the hypoxia will develop. इसके पहले नहीं डेवलप होगा, इसके बाद में अराउंड इतना हो गया है, तो इसके पहले तक तो अपन अडेप्ट कर लेते हैं. After 3,000 meters or 10,000 feet, then the hypoxia will develop. This is due to decline in the alveolar PO2. क्यों हुआ? At high altitude reduce beta? It is due to the decline in the alveolar PO2 to about 60 millimeter mercury. 60 millimeter mercury. तो ये क्या होता है? PO2 is decreased. So it affects the respiration. Ascend to more than 5,000. If it is more than 5,000 meter or around 15,000 feet, or around 15,000 feet, produces severe hypoxic symptoms. It produces severe hypoxic symptoms. So, in what we have studied in this point is that one, if it ascends rapidly, see, we are using the word rapidly, it is very important. Rapidly. क्योंकि स्लो असेंड में क्या होगा? एडेप्टेशन हो जाएगा, तब हाइपोक्सिया नहीं होगा. बट वन इफ द पर्सन असेंड्स रैपिडली टू around 3,000 meters, then the hypoxia develops due to the decline in the alveolar PO2. And if the ascent is more than 5,000, yes, more than 5,000 meters, then it produces severe hypoxic symptoms. So symptoms कब से start हो जाएंगे? 3,000 meters and above. And if the ascent is rapid, then another cause, let's see the other conditions. Hypoventilation. So in which conditions the hypoventilation can occur? Like, yes, airway obstruction, paralysis of respiratory muscles, any depression of the respiratory center, or scoliosis. These all conditions will lead to the hypoventilation. So it will lead to the hypoxia. So कौन सी conditions we have studied? Yes, very good. Airway obstruction, paralysis of respiratory muscles, any depression of the respiratory centers, or scoliosis, or causing hypoventilation. Then another condition, diffusion defect. Diffusion defect. This diffusion is seen in which conditions? Pulmonary edema or fibrosis of the lungs. So whenever there is pulmonary fibrosis, then also this will lead to this condition. Or lung collapse. Or lung collapse. So any diffusion defect will also lead to the hypoxic. Then another condition, yes, mismatch ventilation perfusion. So whenever the ventilation perfusion mismatch occurs, this will lead to decrease in the availability of the oxygen, hence leading to the hypoxia. Whenever there is perfusion of poorly ventilated alveoli is affected, whenever the perfusion is affected, like in which conditions? Large evasions, atelectasis, lung collapse, or cyanotic congenital heart disease. So heart diseases में भी hypoxia हो सकता है बेटा. Cyanotic congenital heart disease. So cyanosis हो रहा है, ठीक है? Cyanotic congenital heart disease will also lead to the hypoxia. So ventilation perfusion mismatch conditions are what? Large evasions, atelectasis, lung collapse, and cyanotic congenital heart disease. These all jo last mechanisms we have seen, they are also labeled as the respiratory hypoxia. They are also labeled as what, beta? Respiratory hypoxia. So you may be sometimes asked in the Viva also, what is respiratory hypoxia? So here are the conditions and you can tell easily. So you'll get more marks. Then another type, we'll switch over to the another type. Next is the anemic hypoxia. Anemic hypoxia. Now, again, the name itself is telling you the definition. Yes. Anemic hypoxia means when PO2 of the arterial blood is normal. Here PO2 is normal, mind you. Just note, when PO2 of the arterial blood is normal, but the hemoglobin to carry oxygen is not adequate. Hemoglobin to carry oxygen is not adequate in amount. Then the anemic hypoxia. So here, what is the difference between the hypoxic hypoxia and the anemic hypoxia? Yes, there the PO2 is decreased. Here, PO2 of the arterial blood is normal, but the hemoglobin to carry oxygen is not adequate. So that's why it will develop the anemic. Now, what are the conditions? Yes, anybody can tell me? What are the conditions that lead to the anemic hypoxia? Yes, one is anemia itself. Anemia, where there is decreased hemoglobin concentration in the blood. So whenever there is decreased hemoglobin concentration, so sufficient oxygen will not be carried. This will lead to the another condition, carbon monoxide poisoning. Carbon monoxide poisoning. This will also lead to the anemic hypoxia. Then altered hemoglobin. The conditions which causes alteration in the hemoglobin. So what will happen? That hemoglobin is not available to carry sufficient oxygen. This altered hemoglobin, when we can see? Yes, in meth hemoglobin. Meth hemoglobin. This will lead to the, again, anemic hypoxia. तो कौन कौन सी कंडीशंस हमने देखी? Anemia, yes, in which there is decreased hemoglobin concentration in the blood. Another, yes, carbon monoxide poisoning. Then altered hemoglobin, like meth hemoglobin. Good. What is the mechanism of anemic hypoxia? Yes. So PO2 of the inspired air is normal, that we have already seen. PO2 partial pressure of the oxygen is normal. And diffusion capacity of the lung is also normal. But the PO2 of the arterial blood is normal. Okay. But oxygen supply to tissue is reduced. Oxygen supply to the tissue is reduced. Underline. Why it is reduced? As adequate hemoglobin is not available. Because adequate hemoglobin is not available to transport the. So here difference what we are noting is PO2 of the inspired air is normal. Okay. Diffusion capacity of the lung is also normal. But adequate hemoglobin is not available to transport the. Hence, this will lead to the anemic hypoxia. But in mild to moderate anemia, the oxygen supply is not severely affected. Why? Because of the presence of, yes, 2,3 DPG. As there is concomitant increase in 2,3 DPG in the red cells. So when in mild or in the moderate anemia, there is increase in the 2,3 DPG occurs in the red cells. So such patient will develop severe hypoxia during exercise. During exercise. Why? Because क्यों बेटा exercise में why? क्योंकि and when we are exercising or when you are exercising, then the oxygen requirement increases. So during exercise, due to their limited ability to deliver the oxygen to the tissues, this will lead to the hypoxia. Okay. So to conclude, what we have said it is PO2 of the inspired air is normal. Yes. And the diffusion capacity is also normal, but the adequate hemoglobin is not available for the transportation of the oxygen. And in the cases of mild to moderate anemia, there is increase in the 2,3 DPG in the breast. But patient will develop severe hypoxia during exercise. Why? Because of the limited ability to deliver oxygen to the tissue. To the tissue. Now, what happened in the carbon monoxide poisoning? What happens in the carbon monoxide poisoning? In this case, the affinity for carbon monoxide for hemoglobin is much more. Carbon monoxide की क्या है बेटा? Yes, affinity for the hemoglobin is much more. कितनी much more? Affinity of carbon monoxide for hemoglobin is about 210 times greater. 210 times greater than the affinity of oxygen. So carbon monoxide for hemoglobin is affinity is 210 times more. इसको भी मार्क कर लीजिए. Make a star. Okay. So carbon monoxide combines with hemoglobin to form carbomonoxyhemoglobin, or carboxyhemoglobin or carboxyhemoglobin. So in this poisoning, in this carbon monoxide poisoning, release of carbon monoxide from carboxyhemoglobin is very slow. Why? Due to its high affinity of carbon monoxide to hemoglobin. So ये जो कंपोनेंट बना है कार्बोक्सी हीमोग्लोबिन, ये ऑक्सीजन की अवेलेबिलिटी को स्लो कर देता है. इसकी खुद की हायर एफिनिटी है टू कैच दिस. हायर एफिनिटी is there more, so it will release the oxygen slowly. Therefore, oxygen cannot bind with hemoglobin. That's why oxygen cannot bind with the hemoglobin. So what happens in the poisoning? The release of carbon monoxide from the carboxyhemoglobin becomes slow due to its higher affinity for the hemoglobin. Therefore, in this poisoning, though the hemoglobin content is normal, hemoglobin क्या है बेटा? Normal है, कम नहीं है. Hemoglobin content is normal, but hemoglobin itself is not available to deliver oxygen to the. So hemoglobin content is sufficient, is not reduced, is normal, but its availability किसकी बेटा? Hemoglobin. Hemoglobin की availability. Hemoglobin is not available to deliver oxygen to the tissues. This will again lead to the hypoxia. Therefore, the carbon monoxide poisoning is also classified as anemic hypoxia. Is also classified as anemic hypoxia. So, therefore, in carbon monoxide poisoning, the hemoglobin content is normal. We have seen this. But the hemoglobin dissociation curve shifts to left. Very important. It is important viva question. Of course, in theory, this concept you should have. The curve shifts to left. Mark it. The curve shifts to left. That decreases the release of oxygen from hemoglobin. So, ultimately क्या हुआ? There is decreased release of oxygen from hemoglobin, and the oxyhemoglobin dissociation curve, hemoglobin dissociation curve will shift to left. Is shift to left. This is commonly asked that in this type of poisoning, where the curve will shift and why. So you should know the reason very well and mention it. Then another type of hypoxia is stagnant hypoxia. Stagnant hypoxia. What is its another name? Hypoperfusion hypoxia. Hypoperfusion hypoxia. So what is stagnant hypoxia? Write the definition. When hypoxia occurs due to decreased blood flow. इसकी वजह से हो रहा है बेटा hypoxia due to decreased blood flow to the tissues. To the tissues. This is called stagnant hypoxia. This is called stagnant hypoxia. That is stagnation of flow is there. तो इसलिए हमने इसको we have also labeled as hypoperfusion hypoxia. Hypoperfusion hypoxia. So stagnant hypoxia or the hypoperfusion hypoxia. So whenever the hypoxia occurring due to decreased blood flow to the tissues, this is called stagnant hypoxia. As in this case, the stagnation to the flow. This is called hypoperfusion hypoxia as it will cause decreased perfusion of the tissues due to stagnation of the. So stagnation of the blood flow ho gaya, and this is causing decreased perfusion to the tissues finally, leading to the hypoxia. This is also sometimes called as ischemic hypoxia. What it is also called sometimes? Yes, ischemic hypoxia. Ischemic hypoxia. तो हमने क्या क्या नाम पढ़ लिए? Stagnant hypoxia. Yes. Then hypoperfusion hypoxia. And then sometimes also ischemic hypoxia. Ischemic hypoxia. Causes. What are the causes of stagnant? Causes of stagnant hypoxia is seen in heart failure, is seen in heart failure, yes, shock, yes, and vascular obstruction, that causes specific organ hypoxia. That causes specific organ hypoxia. Okay. So what are the causes? Stagnant hypoxia is seen in heart failure. Note the points, beta. What are the causes? Just note it. Heart failure, shock, vascular obstruction, that causes specific organ hypoxia. After this, 5 minutes. Stagnant hypoxia is seen in heart failure, shock, vascular obstruction that causes specific organ hypoxia. Now, what will be the mechanism? In stagnant hypoxia, oxygen content of the arterial blood is normal. Oxygen content of the arterial blood is normal. Hypoxia is occurring due to stagnation of blood in circulation. Therefore, there is, yes, stagnation of blood. Therefore, this is also called circulatory hypoxia. Therefore, it is also called circulatory hypoxia. It occurs either due to decreased cardiac output. Causes क्या है बेटे? It occurs either due to decreased cardiac output or decreased blood flow secondary to some other cause. So important and another causes are decreased cardiac output or decreased blood flow. Now these causes can be secondary to the any causes. So another name what we have studied, stagnation of the blood in circulation occurs. Therefore, it is also known as circulatory hypoxia. Causes decreased cardiac output or decreased blood flow occurs in chronic or complete stagnant hypoxia. Local acidosis will come. Local acidosis will develop due to accumulation of lactate that inhibits the cellular metabolism. So, in the case of stagnant hypoxia, there will be local acidosis will also be seen. Why this happens? Due to the accumulation of the lactate. Due to the accumulation of the lactate that inhibits the cellular metabolism. So, what to summarize it? Yes, in stagnant hypoxia, oxygen content of the arterial blood is normal, but the stagnation of the blood occurs in the circulation, and therefore it is also known as the circulatory hypoxia. Causes we have already seen, decreased cardiac output occurs, is seen in this condition, or decreased blood flow. And also the local acidosis will be seen. So I'll just conclude my lecture, what we have studied. So the student at the end of the lecture should know about the definition of hypoxia. Yes, is reduced oxygen at the tissue level or decrease the of the oxygen at the tissue level. Types of hypoxia. Yes, hypoxia, anemic hypoxia, histotoxic hypoxia, and stagnant hypoxia. So I'll stop here itself. Okay, thank you. And just go and read the questions. And any problem, you can ask me the questions. Thank you so much.